Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide commentary and education on all sorts of sports and exercise injuries for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, I think sports and exercise, at least, granted, I feel like I'm old, but I'm really, in the grand scheme of things, not that old, but it seems to me, just in my short life, that more and more people exercise than ever before. And I think more people play sports than ever before. And they're also doing it later in life. People don't stop jogging at 30 years old anymore or playing sports. I had somebody in my office yesterday, recreation league tennis player, plays in the leagues where they go against people at different clubs and have playoffs and tournaments and all this, and she was in her mid-60s. So people are doing sports, they're exercising much later in life, but they also get hurt. And so one of the questions that I get sometimes is, am I too old to have surgery? So in today's Ask Dr. Geyer video, I'm going to answer that question about an injury that, yes, typically occurs in younger athletes, but what should somebody that's older with that same injury do about it? Daryl from England, very cool, somebody from England that we're talking about. Daryl writes, I snapped my ACL about 7 years ago and had it reconstructed. I snapped it again and now I'm 52 years old. The consultant doesn't want to do it, as he says there's an age limit that they stop doing them. I'm still very active in sports. Well, that's a terrific question. I get people all the time, either in my office, in my practice, or I get people, readers and listeners that ask that very same question, that say, I suffered an ACL tear and I want to keep playing sports or I want to keep exercising, but the orthopedic surgeon told me that I'm too old. First of all, that is an injury that by and large occurs in people under 40. It's just the nature of how you tear your ACL. You land from a jump in a competitive sport, or you plant your foot to change directions and you feel your knee explode because your ACL tears. And so you typically see it in younger people, again, people that play competitive sports. It's not to say that it can't happen to older people, it's just there aren't as many people doing activities where you would tear your ACL. You don't tear your ACL over time with things like jogging. There's usually a specific event. But yes, absolutely, as the population gets stays active as they get older, we're seeing more of these in people in their 40s and yes, even in their 50s. I had somebody literally within the last few weeks in my practice that tore her ACL at 70 years old while skiing, and she strongly considered doing surgery for it. So, and I've done a number of these ACL reconstructions in people in their early 60s that were very active. I had one that was a black belt in karate, and she did terrific after surgery. Where I did my orthopedic surgery residency, at least while I was there, the sports medicine attendings, the oldest patient they had ever done an ACL surgery was 47. So there is that mentality. I don't know if they still feel that way, honestly, but that mentality is out there. But I think you're seeing more and more of these being done in people in their 40s, in their 50s, maybe even in their 60s. Is the rehab a little harder? Maybe. I mean, you're going to have to work just as hard as the high school kids. It's going to take 6 or 9 months, sometimes longer, for it to feel normal. So a lot of work with a physical therapist. But in my mind, there's no reason that you can't get back to sports and exercise. If you go in, the surgery goes well, you work really hard on it after surgery, I think that it's really, you can do really well. I think you could make the case, though, if you're not an athlete that does a sport that involves landing from jumps or changing directions, all you like to do is maybe walk 20 minutes a day, you probably don't need to have your ACL reconstructed, assuming that your knee is not unstable with daily activities. It's the people that do activities that involve changing directions, landing from jumps, or that's real aggressive. So any kind of competitive sport like that, an exercise where you're landing from jumps or changing directions, or something like skiing, then I think it can be really reasonable. A lot of factors go into that, but that's my general rule of thumb, that you're not really too old. Age is just one factor among many. Okay, have you torn your ACL? Especially at an older age, and I don't mean by any means to call somebody old, because you're not, but old for ACL injuries, 40s or 50s. What did the doctor or what did the orthopedic surgeon tell you? What did you decide to do about it? If you had that surgery, in your 40s or 50s, how did it go? Really would love to hear your experiences, your thoughts, your comments. So below this video, leave your comments, not just because I want to read it, although I do, but so it can help other people people that are going through this very same thing. Maybe it can help them make a decision. And if you know somebody that's torn his or her ACL and think this video could be helpful for him, helpful for her, please share this video. I'd love to get information out, in a large way to people so that maybe it can help them, make a decision that's best for them. Now, if you like information like this on sports and exercise injuries and injury treatments and injury prevention, subscribe to my video channel. I record a couple of these videos every single week, and I would love to deliver those directly to you. And last, there's so many resources that I create, audio, video, written content on ways to stay healthy and perform your best that I only share with my email list. So go to my website, drdavidgeyer.com. At the very top of the page, enter your name and email address, and I'll share those with you on a regular basis. Look forward to connecting with you that way. Thank you so much for watching. I hope this was helpful, and I look forward to seeing you right here next time.